Hello, and thank you for joining us for this edition of Matters of the Heart. My name is Dr. Srivastava from Pentucket Medical Cardiology. And I'm here today with one of my associates, Dr. Seth Bilazarian, and we're going to today talk about vitamins and supplements and how it relates to your heart, which is obviously a very important topic, as most of our patients are dabbling in vitamins to some extent. So I think it'd be useful to go over this. So I'll turn it over to Dr. Bilazarian and see where we want to start with this.
Yeah, I'd like to have you help me in terms of what questions you're hearing patients talk about as well. But we'll start with our first slide just to talk about what vitamins are. Vitamins aren't really any kind of food. They're really just like a chemical that helps with the reactions of the body. So it's a diverse class of 13 different, if you go to the prior slide, vitamins, diverse class of 13 specific nutrients. These are very complex. They are compounds that really don't have any energy, meaning they don't have any food value. You can't live off of these things, but they make a significant contribution. And actually, if you're deficient in these vitamins, severely deficient, you have severe problems. And we all know the story we learned when we were kids from history about British sailors trying to avoid rickets. They would eat citrus. They realized that that was a source of vitamin C, and they hence became called limeys. And that's sort of our early introduction to what vitamin and vitamin deficiencies might mean. But then if we go to the next slide, vitamins is just one component of the thing that we deal with our patients. Vitamins are, in fact, this one thing. But if you show the next slide, we're talking about just any other kind of thing, whether it's no prior slides, supplements, talking about things called alternative therapies, complementary therapies, or natural therapies. So let me just briefly talk about it. So a supplement is something that is added on top of. That's what to supplement. So we add something on top of something else. An alternative therapy would be something that we take instead of. And you and I were recently discussing some interest that people have in taking something for lowering cholesterol instead of the usual cholesterol-lowering medicines called statins. And there's some interest in this compound called red yeast rice for that. That would be an alternative therapy. Complementary therapies would be another way of talking about things that work together. So you might take something that's useful in addition to a prescribed medicine. And I think the thing that you and I use often for our patients would be fish oil, which would be a dietary supplement, fish oil, on top of a statin medication, which is a prescribed medicine. And then last would be natural therapies, which would be any therapy that is considered to be sort of not a pharmaceutical synthesized product.
Like herbal?
Herbal, I guess. Herbal would be, I think, a good thing. Now, the real thing that I really want to hammer home here is that natural has such a nice sound to it, but it doesn't necessarily mean that it's good, because we don't know about how it was prepared, whether it was safely prepared. Just because it says natural doesn't mean that it's good. So I'm going to harp on that a fair amount, because
And there are plenty of harmful products naturally occurring.
Exactly,
Yeah,
exactly right, exactly right. So the next slide I just mentioned is just the general things that bad things can happen, even if you take a good thing like a vitamin and you take too much of it.
Sure.
Really seriously bad things can happen with the 4 vitamins that are called fat soluble. And I've shown 3 of them here, A, D, and K. But the mnemonic A, D, E, K, ADEC are the 4 fat soluble vitamins. And just really nasty things can happen. You can see here all kinds of bad things can happen if you take too much of these vitamins. So I'm only putting this up briefly to just say, you know, don't go crazy taking huge amounts of vitamins, because bad things can happen. Not just with the fat-soluble vitamins like the ones I'm showing here, but even the water-soluble vitamins. There's better reports of kidney stones and other things that can happen. So caution, not just with the quality of what you're taking, but also potentially the quantity. Sure. So just to move on, these different vitamins are really a critical thing, and there's a fair amount of emerging information that have just been in the journals, and I know you've been reading them with interest for the last several months, about vitamin D, for instance, one vitamin that may be something that we've been neglecting in terms of just overall health. So people are deficient in vitamin D, or if they are in terms of they are not getting adequate synthesis, or their body not making adequate amounts of vitamin D. And vitamin D, we all know, we learned long ago that vitamin D is important for the regulation of our bones and those kinds of calcium-containing and phosphorus-containing structures. If you want to go to the next slide about vitamin D. But we're now really learning that vitamin D is maybe very important in a predictor of bad outcomes for heart disease. And of course, as cardiologists, we're very interested in that. So the vitamin D issue here is really an important one, and one that's important, I think, for where we live in the world, because vitamin D is made by our exposure to sun. So for those of us who work long days indoors and go in before the sun rises, like you and I, and come out after the sun sets, we are at risk for that, especially in the winter months. And there may be, even if you're outdoors in the winter months, inadequate amount of sun exposure in our part of the world. So vitamin D is something that's very important for us to be thoughtful about. So, but the healthiest thing we can do is get 20 minutes of sunshine daily. It's an excellent source of vitamin D. And it's said that you would have to drink dozens and dozens of glasses of vitamin D fortified milk to get an equivalent amount of vitamin D you would get from 20 minutes in the sun.
And if somebody takes a multivitamin once a day,
right,
is that get the job done? Is that?
It may not. I mean, if someone is, of course, it depends on the depth of their deficiency.
Sure.
But probably not if someone was deeply deficient.
I got it. All right.
So just to talk about this a little bit, what you and I are really focused on is trying to do the right thing for our patients. And we talk about this every time we meet here. Yeah. We talk about what's the information, we say the data that's in journals, what's out there that makes us really confident that doing this for the patient gives us the desirable outcome. And for us, the desirable outcome is no heart attacks, no strokes, leading a long life that's full of excellent quality. That's really what we want for our patients as cardiologists. So some of our patients think that we're negative on vitamins or negative on natural remedies, and I am not. I'm open to those remedies if they are demonstrated to be good. But I don't take the position that because it's a vitamin or because it's natural that it's good, it needs to be proven. And I think that there is now several good trials that have been conducted by excellent universities and very good cardiology groups around the world where they've honestly said, let's look at the question. If we give people vitamins in a very good way and follow these patients in a study, will they have less heart attacks and stroke? And then the next series of slides are kind of busy, but I just want to go through them briefly. So the first slide I want to show is a bunch of selected control trials of antioxidant supplements. And this is primarily vitamin E. And it's kind of a busy slide, but I'll just show turn your attention to the left part of the slide, where it shows the column is NO, which means the number of patients. And the number of patients in the first study is an Italian study called the GISI study, 11,000 patients. The next one is a European study called HOPE, 9,000 patients. The next one, 4,000 patients. The next, 3,000 patients. So really a huge number of patients. And that's really important to you and me about trying to decide whether this is a good and legitimate study. Because you can't do a study in 2 or 3 patients and say, oh, this works. Right. Because some of our patients will say that to us. They'll say, my friend took vitamins and they felt better. And we don't want to be dismissive of it, but that doesn't help us know, because that person may have been deficient. Maybe it really did feel better and they needed it, but that doesn't mean everybody should take it. Right. So that's really where we get off here. And this first slide I really want to focus on shows that in these huge studies where they gave both synthetic and natural vitamin E in different doses, there was no benefit with regard to preventing heart attack or stroke. Looking over a number of years, 3 and 4 and out to 6 years, people were followed, half of the patients on the vitamin E and half on placebo, no benefit with heart attack. So pretty convincing evidence. So when I started practice 15 years ago, I recommended vitamin E because it's kind of made sense. Mm-hmm. But this data all shows pretty overwhelmingly that vitamin E cannot be recommended. There's no reason to recommend it because these studies are very well conducted. Right. Is that your position?
Absolutely. Absolutely.
Okay. So let me just go to the next studies. And people can sort of nitpick these different studies, but the next slide will show a couple of trials that show that there is a benefit from vitamin E. But I just want to caution that this is how people can get confused. And again, I don't want people to get too far into the detail, but you see that these, if you look at the number column there, the second column over, NO, it says 2,000, 1,800, 196, 520, and only 40 patients. The bottom of that says 40 patients. Well, what's the point of looking at a trial with only 40 patients? Probably not very helpful, but these trials did show that there was some benefit, but again, not enough to convince us when you compare it to the huge trials that showed no benefit.
Absolutely.
And I'll just skip to the last one. And a lot of people, I want to show this last set, which shows the bad things that can happen in these trials. And if you look in the far right column, there was in a trials of vitamin E, an increase in stroke, people bleeding into their brain from vitamin E.
And that was a pretty large study as well.
Yes, 29,000 patients. So there was more people who bled into their brain and had what's called a hemorrhagic stroke in vitamin E group than people who had placebo. Increased overall mortality in another trial. And then at the bottom is a small trial that you and I know about fairly well called HATS, which showed that when you add vitamin to patients taking cholesterol medicines, it wipes out the benefit of the cholesterol medicine. So patients are taking an expensive cholesterol medicine that might cost $100 a month and a vitamin that costs a few dollars a month, and that vitamin is wiping out the benefit of the expensive cholesterol medicine. So my only point of all this, and I would just say, just to focus back here on your discussion with me about it, I would say that we are open to these things, but we have to be very cautious in interpreting it. And for instance, in the vitamin E area that's really been extensively evaluated, there's really no demonstrated benefit in very large studies, and perhaps even harm. So how can we extrapolate that data with other vitamins? I guess that's what my thinking is.
Right, well, I was going to ask a question, maybe it's a little changing topics here, but just I get this question all the time. Should I take a multivitamin? Is that going to help me? Is that good or is it not? And in light of all this that we've just talked about here, what's your take on that? Is it a benefit? Are you even absorbing all these vitamins that are packed into that one little pill? Yeah,
well, you're asking two questions, which are excellent questions. One is an efficacy question. Does it work to help with health? And the second question is it safe? And the multivitamins, I think, are basically packaged in a way that the dosage are not so high that I would be very concerned about it from a safety standpoint. But I really doubt seriously whether it has any efficacy for a person who's eating a relatively well-balanced diet. And another segment of Matters of the Heart, you talked about different diets and about eating a well-balanced diet, a diet that's rich in fruits and vegetables. I would doubt seriously, I mean, I don't have the proof for it, but if we could look into the future and see a study that was done this way, that there's any benefit from taking a multivitamin in a person who eats the recommended 4 or 5 servings of fresh fruits and vegetables per day. I would doubt that.
Yeah, I would agree wholeheartedly.
But in my patients who I'm trying to not have huge conflict with, I tell them that if you want to take a multivitamin, I don't object to that. I think it's probably safe, and those are the exact words I use. It's probably safe. I can't prove it's safe, but it's probably safe. It might be beneficial. And then I joke with them because it was told to me by a professor that Americans probably have the most expensive urine in the world.
That's right. Well,
because most of this probably passes out in our urine without ever really providing any benefit.
Yeah, that's why I asked the question about the absorption of it, because I'm really skeptical that we're absorbing, the pill, you read the back of it and it says 100% of your vitamin A for the day, 100% of your vitamin C, 100% of everything.
Right.
And I'm really skeptical that our bodies can absorb that in one quick pass through.
Sure.
Nevertheless, then moving on, and I think your next slide that's ready to come up is looking just at this topic, right?
Right. Well, what are people taking out there? So there's a large study called the NHANES trial that looks at people who are just free-living people, not people who are in hospitals or in institutions, but just going out looking at people who are free-living. And it's looked at a variety of things, but one of the things we're looking at here is what people were taking when this study was conducted. This study is probably about 10 years old now. And it matches up for me largely with what people take when I hear. Everybody seems to like vitamin C. It sort of seems like the safe thing. And
if they start to get a cold, they'll pop a few extra vitamin C's.
Right. And the person who was responsible for understanding vitamin C's synthetic benefit in our body, Linus Pauling, won a Nobel Prize, and he's been lionized as a saint of medicine for that work. So I think there's a lot of that, and these other things sort of fall down afterwards. But I think that a lot of this sort of moves around. I would think that in the last several years, there's less people taking vitamin E. So as we look forward, there may be less people taking vitamin E. I think less than a third of patients now take vitamin E. So some of this is changing, and a lot of it changes because someone has a new idea that, oh, well, this is probably good for you because it might act in a certain area of our body that might be beneficial. But there's really no data, and this gets to be generates a fair amount of enthusiasm. And it's unfortunate because we don't know a lot about whether they are effective and safe.
All right. Well, I think at this point it might make sense. We've talked about vitamins quite a bit, and you at the very beginning had mentioned a few other types of compounds you wanted to discuss.
Right.
One of which being these natural products or herbal products. And there's a lot of them I've never heard of, but there's certainly quite a few very popular ones that I have a lot of people who take, and maybe you can start commenting on that a little bit.
Sure. Well, let's look at this slide that looks at, again, the top 10 natural products that are used by Americans. And echinacea, I know, is recommended by several of our primary care colleagues for respiratory illnesses or common cold type things for both prevention and treatment. There are echinacea teas, a variety of strategies that people use. Again, I have no information about effectiveness or safety, but it's one of those.
I don't think anyone has information about it.
Right. So, but when you and I are talking about dealing with a patient who's on other medicines for their heart, they're on medicines after a heart attack, maybe medicines like aspirin and Plavix, or they're on medicines for diabetes. Can echinacea be recommended? No data. So these are the issues that we deal with. And the reason why that's pertinent is the third bar over here going over is a medicine called ginkgo biloba, which several years ago had a lot of use because there was suggestion that it might protect memory. And many of our senior patients are very concerned about memory loss, about dementia, Alzheimer's dementia. It's a legitimate concern. I'm not in any way minimizing that concern, but the idea that ginkgo biloba might be effective is really there's no data for, and data subsequently came out that shows that if you take ginkgo biloba with aspirin, which many patients take, the risk of bleeding in the brain and having a stroke in the brain from bleeding is substantially increased. So this is that kind of thing that until it's studied, people say it must be safe.
And I think that really underscores the importance of you can't recommend these things. Right, absolutely. And no one knows how these naturally occurring products interact with a lot of the commonly prescribed medicines.
Right. So again, just to mention a few others, garlic is on this list. I think the data on garlic is completely underwhelming in terms of cholesterol. It just doesn't work with cholesterol. There's a few trials with a few patients that show there's a benefit. There's a whole bunch of bigger trials that show no benefit, so that's garlic. Glucosamine, I think, seems to have some pretty decent studies showing it is effective for osteoarthritis. There's a pretty good German study showing it's effective for knee osteoarthritis. So I think that's probably a legitimate thing for people who want to take it for osteoarthritis. I don't know about its combination of safety with other medications. St. John's wort is purported to be beneficial for depression. Very little data in terms of safety or efficacy in that regard. Soy supplements are actually very interesting in that soy supplements seem to have a very similar chemical structure to the female hormone estrogen. And estrogen was recommended for many years, as you know, for women who were after the menopause, thinking that it might be beneficial to prevent heart disease, and was subsequently found that actually it does the opposite. It actually increases the risk of heart disease. So what do we think about soy? Well, maybe we should think the same about soy, but we don't hear that. We don't know. Right. So caution, I would say, again, with that.
Right. Actually, I'm curious about one other one on that graphic. You don't have to necessarily put it back up, but fish oil. Maybe we should talk about this separately, but fish oil is actually not so commonly used based on that graphic. It's probably the third least. And interesting, I think that's probably one that has some of the most data.
Yes.
And maybe you can comment a little bit about what the use of fish oil would be.
Well, we use fish oil. I think that you and I recommend it because it's been recommended through a lot of good studies, and it's been recommended by our cardiology societies, by expert panels sort of getting together and deciding, is this a responsible and reasonable thing to recommend for both effectiveness and for safety? And yes, we do recommend it. I don't know about you, you tell me what you do, but I don't recommend it in all my cardiovascular patients, but I strongly recommend it in a particular group of patients who have a high triglyceride because it is an effective strategy to lower high triglycerides, which are an important risk factor.
Absolutely. I think that covers that particular topic pretty well. And I think you were then going to move on to talking more about some dietary supplements, for example.
Yeah, let's hammer home the point that I'm trying to make about dietary supplements. So let's move on. It's sort of a busy slide, but I'll just talk through it. Dietary supplements are substances that you can eat or drink, and they can come in any form as a pill, a capsule, a liquid. Some people have them as a powder. These are widely available in health food stores, grocery stores, in organic stores. What I found when I sort of do my little snooping around, I go in these stores, is that usually these stores are manned by somebody who has some interest in these natural remedies, but doesn't have any real training. So they'll say to a customer, when I'm in a store like this, oh, well, this is good for impotence, or this is good for aging, or this is good for memory. But there's no data for it. People just say, oh, well, that's good. I'll pay $25 for that, and I'll take it. So those are the issues that concern me. Makers of these supplements are not allowed by law to say that they're treating a problem, preventing a problem, but they can say that it helps with health maintenance. So that's sort of the tricky area. Sometimes these supplements are the basis of other future medicines. Willow bark tea, for instance, is really the same chemical that's in aspirin. So I'm not in any way saying that there isn't a connection here. These things can have real effects on the body in a medicinal way, but it is important. But I do want to really hammer home this final point, that the FDA does not regulate dietary supplements in the same way it regulates medicines. You may know that the FDA goes out to plants that are making the medicine. They actually inspect it for cleanliness. They inspect to see if the drugs are pure, if the drugs are potent. When you get a 10 milligram tablet, is it really 10 milligrams or is it 15 milligrams or 5 milligrams? The FDA is very strict with medicines, but they're not at all. There's no inspection of these plants. So what's in there? Is there good stuff in there, bad stuff in there? Or
I have an interesting anecdote to add to that, where when I was training in Boston, very close to Chinatown, and a patient came in, elderly patient came in using a lot of herbs from one of the local herb shops in Chinatown. And she came in really sick, nauseous, vomiting, blurry vision, couldn't see anything, dehydrated, electrolytes were really out of whack, and it was really hard to put together what was going on. And there for several days, a lot of different specialists weighing in, trying to figure this out. And one of the relatives brought in some of these herbal, they were put in pill form, but supplements, and really piqued a lot of curiosity. We ended up getting it analyzed. It took a long time to get it back, got it analyzed. And this pill, which was purported to just be general health maintenance, had a lot of medicines in it. It had some narcotics in it as far as painkillers go. It had a medicine called hydrochlorothiazide in it. It had another medicine called digoxin in it. Wow. All of which, are prescription medicines. Right. And sure enough, she was showing signs of toxicity of a lot of those different things. Her electrolytes were really out of balance from the diuretic, the hydrochlorothiazide. She had signs of digoxin toxicity, and in fact, her levels of digoxin in the bloodstream were really elevated, which no one thought to measure to begin with because she wasn't taking digoxin. Right. And
she wasn't known to be taking digoxin.
Exactly, right. And so it was really striking, and I think it really was a powerful message about the importance that just because it's natural, right? And this wasn't natural. This was someone
purported to be natural.
This was just somebody messing around, right, and making a buck off people,
right?
And clearly the FDA is not overseeing
right.
this type of.
Well, it just happened again the last month. I saw this happen several times, but these natural remedies for erectile dysfunction or impotence sometimes contain Viagra. So people are actually they think they're taking a non-prescription medicine when in fact they're just taking, as you just said, with your patient experience. So just to make a few more points that we could just skip the dietary supplements. I think we won't go on to that, but let me just go to the last comment on dietary supplements, that not all herbs and supplements are safe. I just want to make that clear, that I think I've hammered this home both in our personal experience as physicians, but also from a lot which has been written. And that you should really tell your doctor if you're taking supplements. I try to take a complete medicine history for my patients and ask, are you taking anything else? And a lot of times patients will say, no, I'm not taking anything else. But then it'll come out later on, well, I am taking this other thing. And we need to know that as much as possible to try to help patients make sense of these things. Dietary supplements can certainly cause side effects and trigger allergic reactions. They are chemicals, just like any other chemical, even though they're natural chemicals. People can be allergic to poison ivy. It's a chemical, it's natural, but they can certainly have problems with that. And supplement manufacturing is not standardized. I mentioned earlier, you and I have mentioned the issue about maybe that these things are actually tainted, which is on one end of the badness. But even when they're not tainted, there's no standardization. So that if you're taking even fish oil, as you and I were just discussing, we recommend fish oil, but we know that different manufacturers have different amounts of the actual fish oil per tablet. So it's really different in that even a given manufacturer, because there's no regulation from the FDA, the November batch may differ than the December batch. So it's really very complicated for patients in terms of this whole thing. So other than for vitamins and minerals, the long-term effects of most dietary supplements are not known. So I just wanted to just take this last thing that I would just make a point of, that was from the Today Show medical editor. I'll just completely attribute it to, because this is not mine, but Nancy Snyderman, who's the medical editor of the Today Show, said that when it comes to your health, we can put this up as a slide, you can't believe everything you hear. In fact, some advice passed down from your parents or research on a website could actually kill you. Anything labeled natural must be safe. That's obviously a false statement. These days, about 25% of all prescription drugs come from natural sources like trees, plants, or herbs. Even aspirin comes from willow trees. We mentioned that already. A lot of people assume that a natural remedy is better than a drug prescribed by a doctor. So know this, many natural substances are never tested by the FDA. So if you're taking any supplement, run them by your doctor to make sure they really are good for you. Remember, just because something is natural doesn't make it good or safe. Case in point, both tobacco and arsenic are natural, and both can and will kill you. So I would just make that point, and then not to try to startle our patients, but I think that many people know about what's been in the news recently about a very regulated medicine called heparin, which you and I use regularly in the hospital, a blood thinner, which is very important during angioplasties, during heart attacks, during clot treatments, that some of these were being manufactured in China in not regulated ways, and there's been many deaths around the world from this. It's been reported in the New York Times and a variety of other places. So that in a regulated area like prescription drugs, there was a problem with purity. Can you imagine what happens in a non-regulated area like in supplements and in vitamins, what might happen? And I guess that's my concern. So my conclusion from a cardiovascular medicine standpoint would be, if we could put this slide up, is that fish oil is a dietary supplement that you and I recommend. It's well studied and is particularly beneficial for treatment of high triglycerides. I think it's a very useful thing. There are some other supplements that are on the horizon that we mentioned in passing, which I didn't put on the slide because I'm not convinced yet, but I'm open to hearing more about, and one is red yeast rice, which there's some data that seems to do a good job lowering cholesterol. Of course, even though it lowers cholesterol, we don't know whether it does the good thing of preventing heart attacks and strokes. So that's important. Vitamin E and vitamin B, which we didn't talk about, but vitamin B has really been extensively studied in thousands of patients trying to treat a problem called high homocysteine. No benefit with regard to heart attack and stroke. And there is emerging information about vitamin D, and I'm beginning to test more of my patients for vitamin D deficiency, and we'll see how that works out, whether vitamin D supplement in those deficient patients. So that's a pretty fast run through supplements and vitamins.
Great. Well, thank you. This was actually a very educational run through vitamins and supplements for me. So on behalf of Pentucket Medical, Haverhill Community Television, I want to thank you for going through all this, and thank you for joining us on another edition of Matters of the Heart.